and good afternoon. It is Friday, and that means it's time for our regular Lunch and Learn. Thank you for joining me, and I hope you're going to find this very interesting because I sure did. Today, we're going to be talking again about dementia. Now, why are we talking about dementia so much? Well, because people are coming in afraid that they are losing their cognitive abilities, and so anything that we can find out that can help them and that can help me help them, then I definitely want to do that. And so this report came out. In fact, there's two reports written by the same lady, and we'll get to that in just a little bit. But the first report that I want to talk to you about is something that if you take medications, you're going to want to really pay attention to. A lot of people think that dementia is just part of getting old, and it can be, but it doesn't have to be. So if you take medications on a regular basis, your incidence and risk of developing dementia is heightened. If you don't take medications, then you're in a better place. However, you can still grow those plaque proteins in your brain, and we don't want that to happen. And all of us can control if it happens or not. And so I'm going to give you some really practical things that you can do, and then we're going to talk about some medications. And some of these medications are medications that all of us have taken at one time or another, say Tylenol PM or Advil PM. Those, regularly are in this list. But there are other ones. So if you have overactive bladder, or if you have urinary incontinence, which this is something that we see all the time, there are a lot of advertisements on the television, and they're asking us to talk to our doctor and take these drugs. Well, these drugs can actually set you up to have dementia. So we want to prevent it if we can. I don't know that anybody has put their name on that list that, oh, yes, let me lose my faculties. Nobody's done that, and I don't want to do that, and I don't want to be taking something even occasionally. And just so you know, I don't take Tylenol. I don't take acetaminophen, Advil, all that kind of stuff. I don't take it regularly. I don't even take it irregularly. Do I have it in my house? Yes, I do for emergencies. But goodness, I haven't taken a Tylenol probably in 3 or 4 years. And the reason I took the Tylenol when I took it is because I got shingles, which was extremely painful. And that's just a whole nother story. So this is something that if you take these drugs regularly, and I know people who do take these drugs regularly for pain control, if you take these drugs regularly, you could be setting yourself up for dementia. Now, this is a doctor. I think he's passed now. His name was Dr. K.K. Jain, Jain. He was a neurologist and a neurosurgeon. And he says drug-induced dementia is a type of reversible dementia different from common neurodegenerative disorders. All right, several drugs increase the risk of dementia, the most prominent being, and I'm going to say this, I may not pronounce it correctly. I didn't have time to really look up the pronunciation of this, so I'm hoping Hooked on Phonics works for me. So some of you nurses out there can give me a thumbs up or a thumbs down if I mess it up. But one of the drug classes is called anticholinergic. I don't know if I said that right, but that's what it looks like. Anti-epileptics, oncology drugs, sedatives, and hypnotic drugs. All of these are common prescriptions for older people. Now, the anticholinergic drugs are drugs that block the action of acetylcholine. Now, acetylcholine is a neurotransmitter. It's also a chemical messenger, and it signals between certain cells what your body needs to do. So it is a chemical messenger that we have in our brain, and it controls a lot of our bodily functions. So this class of drug has an effect on a variety of conditions, as we talked about: overactive bladder, urinary incontinence, COPD, chronic obstructive pulmonary disorder. And we know people that come in all the time that are on these medications, and then also they treat certain types of poisoning. They help block involuntary muscle movements associated with certain diseases, such as Parkinson's. So if you take any of these, or you know somebody that takes any of these, you really want to pay attention, because we don't want to be those people that are inducing dementia So, psychiatrist Dr. Peter Breggin, Breggin, has published several books on psychopharmacology. Most of the drugs on the market have some degree of neurotoxicity. That means they poison the brain. So we have a blood-brain barrier. It stops, or supposed to stop, things that are not supposed to be in the brain from getting in the brain. However, these drugs, the way they are synergized in the lab, some of them can cross that blood-brain barrier and get us in trouble. It leads to cognitive decline and neurological side effects. Not everyone is going to be affected by this, but older people and those with brain deficits are more vulnerable. So with illnesses that surface with old age, the pills that are used to prescribe for these diseases in older people tend to be those drugs that cause the dementia. So if your grandmother, if your mother, if your older aunt, uncle, whatever, if they're showing signs of dementia, it would be a good idea to check what prescriptions they're taking, because it could be that this is the reversible kind, and if you get them off those medications or change those medications, you could have a really, really wonderful result. And so that's what we want to do. Now, there are some drugs that are used to treat Parkinson's disease. Parkinson's disease, normally you've got tremor in your hand, and you can have the little bobblehead, okay? I don't mean to be disrespectful, but a lot of people don't know what that is. And, oh, by the way, you may know that Michael J. Fox has Parkinson's disease, and here in the Humble-Kingwood area, there is a fun run. I think it's on April the 6th. It's the same day as Good Old Days. The fun run is in Kingwood, and all of those people are raising money for the Michael J. Fox Foundation. Also, there's a restaurant in Kingwood, a Mexican restaurant, that if you go on March the 25th, which I think is a Monday, and you tell them you want the proceeds to go to the Michael J. Fox Foundation for Parkinson's disease, and they will do a portion of your ticket to that charity. Now, you have to tell them, we've got all the information here at the clinic, and so if you want more information, just let us know and put that in there. However, it reminded me, because we're talking about Parkinson's disease, so the drugs that are linked to the symptoms also cause dementia. They block the acetylcholine in the brain as a way of preventing the tremors, all right? Acetylcholine is that neurotransmitter, and we do need it because it facilitates cognitive function. Cognitive function, do you think correctly? Are you thinking straight, as we would say? So we want to make sure that we're not sabotaging ourselves by having medication that is going against what our normal brain function is doing. And I'm really kind of surprised that these drugs stop the acetylcholine, because we have found holistically that if you just increase the dopamine levels, if you increase the dopamine levels, that can have a profound effect on people with Parkinson's. So something to think about when you're looking at that. Also, another common drug is protein pump inhibitors. So if you're taking PPIs, if you're taking reflux drugs, you've got heartburn, so you're taking whatever little pill, the white one, the purple one, it doesn't really matter which one you're taking. But if you're taking that on a consistent basis, that can interfere with your neurological functioning, and it can lead to dementia in some people. It increases your risk. Those drugs increase your risk of dementia by 44%. That's a lot. Do you want to do that? Maybe you just need to have your gut looked at and see what we can do about reducing the reflux symptoms by healing the gut. As early as 1977, experiments using the anticholinergic drugs, scopolamine, maybe I said that right, showed that 40 minutes after the drug's administration, young medical volunteers in their 20s manifested dementia-like symptoms and had a harder time recalling things that they had just learned. These drugs block the autonomic muscle movement and various bodily functions, and are often prescribed for cramping or spasms in various organs. They also function as a sedative. So neuroscientist Diane Goodenough, who has a doctorate in medicine and psychiatry, explains that the acetylcholine system is the same system that controls cognition and mobility, two major functions that are impaired with dementia. When the neurons become unable to release acetylcholine, either because of age or drug effects, their contact with other neurons is reduced, and that starts the brain on its dysfunctional pathway. So we don't want to do that. It causes the brain to shrink. Now, we do know with our older people that they go in for MRIs on their brain. They go in for whatever they're doing, whatever they're testing, and they will tell us how much the brain has shrunk. In some of our previous programs, we've talked about certain minerals that we need in order to prevent brain shrinkage. But we also want to make sure if we're on sedatives that we're making sure that we're not having brain shrinkage, because that leads to cognitive decline. So this brain shrinkage has also been observed in research published by the Indiana University professor Shannon Rasher, who has a doctorate in medical neuroscience. She found that people taking this class of drug have greater brain shrinkage all over than people that don't take this medication. And this is a quote: "Use of medication with significant anticholinergic activity should likely be discouraged in older adults if alternative therapies are available." So she and her co-authors wrote this in JAMA Neurology Study. Examples of these anticholinergic, I'm hoping I'm saying that right, drugs include diphenhydramine, which is the active compound in Benadryl, Tylenol PM, and Advil PM. They are also included in common medications for Parkinson's disease, as we said earlier. Acetylcholine decreases naturally as we age. So, Mr. Goodenough and his team have been attempting to find therapies that increase the brain's acetylcholine levels without compromising the brain's functions. So antidepressants, and how many people are on antidepressants now? Lots, just lots. We have a lot of people that come in here that are on antidepressants, anti-epileptic medicines, hypnotic sedatives, and opioids have also been shown to increase the risk of dementia. All right, they're all psychoactive. The primary function of antidepressants is to block the neurotransmitters such as serotonin instead of acetylcholine. However, these drugs still have potent anticholinergic properties, and when taken with other drugs of the same class, could add to an overall load, potentially inducing side effects of dementia and delirium. Older people with dementia are often prescribed antidepressants, anti-epileptics, and sedative drugs to manage depression and aggression that arise. Now, that makes perfect sense to me, because if I'm getting older, and I am, and we all are, if we start to lose our cognitive function, if we start to lose our bodily function, our mobility, and all that kind of stuff, it's going to make us irritable. Why is that? Because we want to do what we've always done. And so when you see older people and they're crabby and crotchety and all that kind of stuff, well, think about it. You would be too if you were dealing with those things. And so if you are a caregiver of that kind of person, try and be understanding and try to work with alternative practices. So maybe they don't have to have as many medications. If they didn't have as many medications, maybe they wouldn't be so crotchety. All right, we don't want crotchetiness. Dr. Bregan highlights that it is an irony that the drugs prescribed to patients to improve their condition may well exacerbate their illness. So that's sad. All right. Drugs not prescribed for psychoactive treatment have also been linked to dementia. Now, these are type 1 histamine blockers, which control allergies. So if you're taking any kind of allergy medication, you might be at risk of dementia. So your body has allergic reactions because your immune system is overloaded. You get your immune system sorted out and your allergic reaction will go away. Now, I will tell you, as a human, I used to suffer from allergies all the time. And so what happened in my story is when I was a much younger woman, I was pregnant with my daughter, and we moved from England back here to the United States. And we moved into a home, and the previous owners had big dogs, and there were fleas in the carpet. So just imagine me, I've got an 18-month-old child, I'm heavily pregnant with, my child, and we are living in this home and we are being eaten up by fleas. So what do? We call the pest control people. They come in, they spray, and we're good for about 2 weeks. And then in that 2 weeks, we've got another crop of fleas. So we call the pesticide people back and we get sprayed. This went on for about 2 months. Now, was this healthy? No. Did I know what I know now? No, I didn't. But the point I'm making is I was overexposed to this toxicity, and I developed what is called allergic rhinitis, which manifests as allergy symptoms. Now, I'm not proud to say this, but when you don't know, right? So I didn't know anything about holistic medicine at that time. And so I went to the doctor complaining of all the sinus issues and whatnot. And so they gave me antibiotics, they gave me steroids, and they also gave me antihistamines. Now, all of that is a prescription, no pun intended, for disaster, because anytime you take antihistamines, you dry up the nasal passages, and yes, you can breathe, and hallelujah, you can breathe, but you've dried up all that toxic matter, pollen, dust, chemicals, whatever it is, you've dried that up into your tissue. So the next time you get overwhelmed with toxicity and you manifest an allergic response, you're going to have to deal with the current toxins, and you're going to have to deal with whatever is in your tissues. So what is a better thing to do, and what this girl did, is I saw a holistic practitioner, was able to get my body balanced, able to get everything resolved. I've not had an allergic attack like I was used to probably in about 25 years. Very thankful. And so I know because I live in this body, I used to be very, very prone to pollen issues, prone to dust issues, all that kind of thing. And I would have allergy symptoms almost 24/7 year round. I have not had any allergy symptoms in well over 20 years. And so if I can do it, then you can do it too. So if you're taking allergy medications, you might want to double think that, because you don't want to be moving down the road to dementia. There is another type of antihistamine, and it is called a type 2 histamine blocker. These can cross the blood-brain barrier, and so they're more dangerous. So look at your medication, find out if it's type 1 or type 2, and then kind of move forward with this. The practice of prescribing multiple drugs to patients, a practice known as polypharmacy, can cause cumulative adverse effects. And so we see this all the time because we deal with a lot of older people that come in and they can have 15, 20 different prescriptions. And so there is an app that anybody can have. It doesn't just have to be a medical person. Anybody can have. It's called medscape.com, medscape.com. You put in your credentials, or you just have a login. You don't have to be a doctor. And they've got an area on the website that's called Drug Interaction Checker. And it would just be a great idea just to plug in all of those pharmaceuticals and see what kind of events it has. It'll say slight interaction, moderate interaction, or significant interaction. Monitor closely. And the number of people that come in that have quite a few prescriptions, they always have significant drug interaction. And so we send them home with that paper, ask them to talk to their pharmacist and see if there's something else that they could do instead so they don't have these interactions. And that's something that anybody can do. You just need to know that you need to do that. So part of what we do here is give you information so that you can live your best life. So whether a patient will develop cognitive impairment or not when prescribed a particular drug depends on how much co-medications they have that may interact with that drug. This was a quote by Dr. Alan Moore and Sean O'Keefe, who are professors in geriatric medicine. Quote, studies have suggested that it is often the total burden of the drugs that determines the development of delirium rather than any one single drug. While many psychoactive drugs on the market make an attempt to fix the brain, how the organ is supposed to function at baseline is largely a mystery. Now, all of the men in the audience, they already know that there's no way you can predict the way a woman's brain is going to work, right? We all know that. And so the doctors are even saying they don't really know how the brain works. Psychoactive drugs are often prescribed to correct brain chemical imbalances, but researchers do not know what the brain's normal state truly looks like. Yale University professor Avram Holmes illustrated this in his 2018 comment about the brain having no fixed normal state. Quote, there are hundreds of neurotransmitters and that we don't know about, and maybe thousands of them that we have never seen. We have just a few that are deeply affected by psych drugs, and those are the ones that we could study because the drug companies in the pharmaceutical industry will pay for that. Now, isn't that an interesting concept? Now, I don't know how the brain works, and you don't either. Nobody knows. What we do want to do is make sure that our brain is functioning at optimal level. And how do we do that? We do that by making sure that we are resting, that making sure that we are having good vitamins, good nutrients, making sure that our diet is as clean as possible. But even if you had the absolute best diet that money could buy, we do not live in the Garden of Eden, and so we are not getting all of the nutrients that we are supposed to. It is imperative that we take a good multi-mineral, multivitamin in order to have the resources that our body needs in order to function appropriately. So the doctors don't know how the brain is supposed to work. What we don't want to be doing is having medication every day that is altering the way the brain works. So this Dr. Bregan, argues that psychoactive drugs, which aim to address biochemical imbalances within the brain, actually cause the brain to become further maladapted. He gave the example of SSRIs, which increase serotonin levels by blocking serotonin removal. Now, this is an artificial manipulation by the drugs. And yes, you probably get some relief, but you're messing up your total brain chemistry, and there's going to be longer, further out complications that we can't even understand. And so SSRIs are antidepressants. All right. So he observed that the brain experiences two changes while on the drugs. It reduces the serotonin production, and it reduces the power of serotonin removal symptoms. Neurodegenerative diseases like early onset dementia and Alzheimer's are characterized also by protein buildup in the brain, which triggers a stress response. So this is moving into another thing, not drug induced. So like for me, I don't do drugs, but if my brain is in a constant state of stress, if I stay in a constant state of stress, then my brain can lay down amyloid plaques and beta proteins. And when that happens, then we have a higher incidence of having Alzheimer's and dementia. We don't want to do that. Memory loss, changes in communication, and confusion are all signs and symptoms of neurodegenerative conditions such as dementia. So there's a new study that finds that cell stress could be to blame. Turning off this stress response rescues, yay, I like that word, rescues brain cells like those affected by early onset dementia, offering a promising new way to combat neurodegenerative diseases. As the U.S. population ages, the prevalence of neurodegenerative conditions such as Alzheimer's and Parkinson increases. But some degenerative brain diseases start early in life, early onset dementia, that's before you're 65, all right? So we don't want to have that. There was one man who was only 49 that had a diagnosis of early onset dementia. Early onset dementia has increased by 200% over the past decade. So what does that tell you? Okay, what that tells me is that we are ingesting more and more chemicals in our food. We are not having the nutrients in our food because of the way our food is processed here in the United States. And so because we do not have those raw materials and we are eating food that is not food, so think about anything that's labeled zero anything, zero Coke, zero cookies, zero whatever, zero calories, and they're still sweet. They are sweetened by industrial solvents most of the time, unless you've got stevia or monk fruit, right? And so when you're taking in these industrial solvents, you're putting these chemicals that can possibly cross the blood-brain barrier. Now, I saw a statistic, and I made a photocopy, or I took a screenshot with my phone, and it said that, and I think this is right, but I have to go back and look at it. It said that we ingest the amount of plastic in a credit card, the size of a credit card, I think it said every day. I'll have to look at that statistic, but I was absolutely horrified. How are we getting that? Well, we're getting that through the plastic bottles that we drink our water out of, the plastic containers that we eat our food out of, and all the different things. And so, if we're ingesting even if it was once a week, if we were ingesting the amount of plastic in a credit card once a week, that would still be bad enough. And so we have to really look at our environment and what our environment is doing to us and find out why dementia is on the increase by 200% in the last decade. That's just crazy. I think that is crazy. There are no treatments currently for neurodegenerative diseases. Now, what we have seen here in the clinic and other holistic practitioners, what we have seen is that when we do heavy metal detoxes, when we do brain clearing, we've got a formula here that causes the microglial cells in the brain to start to move. That's the lymphatic system in the brain. We know the lymphatic system is part of our immune system that goes in the body and clears out all the trash, takes out all the trash, eats up all the things that are not supposed to be there. Well, you've got a different system in your brain, and we've got a formula that if you've ever had a traumatic brain injury or something like that, it has stagnated that microglial system. And so what we want to do, actually it's called the lymphatic system. Whenever you take this formula, it causes that to move, it causes that debris, pathogens, whatever it is, to be cleared out. And so we've had a lot of success in using this formula with people that have neurodegenerative diseases for whatever reason. So, back to the amyloid proteins, amyloid plaques and tau proteins, all right? This is an abnormal buildup in the brain, and it causes the neurodegenerative diseases. Now, what we have seen is that curcumin, and it has to be a special form of curcumin, it has been clinically proven that you can take this and it goes in and it dissolves and eats up those tau proteins in the brain. So we want to make sure that we take advantage of that if we have that. So the treatments focus on dissolving and eliminating the accumulated aggregates in the brain. So there's a team of scientists at the University of California, Berkeley, who is conducting a new study that found some of these degenerative diseases are driven by brain cell stress rather than the tau proteins or the amyloid beta plaques. Quote, we realize that even though there's a correlation, there's no clear causative links between the protein aggregates and the neuronal death, said researcher Michael Rappe, and it's got an accent on the E, who is professor and head of the Division of Molecular Therapeutics at University of California, Berkeley. When investigating how brain cells die, researchers found that the body's failure to shut down the nerve cell stress response was the lethal factor in killing the brain cells. So what does this tell us? This tells us that stress is a killer. Now, we say that, and people might say, oh, that's just what we say because we don't like being stressed. But honestly, stress is a killer. It will cause your brain to kill off its cells. It'll cause your body not to function the way it needs to. And so stress management is something that we all need to do. It's something that is part of our self-care. And what one person does and what another person does may get the same results, but it's going to be different for everybody because we're all unique and individual. So a good exercise for you is to be mindful about what puts you in a relaxed parasympathetic state. Parasympathetic is, I'm happy, I feel good, I'm not rushed, I'm relaxed. Sympathetic is hurry, it's urgent, I've got to go, the saber-toothed tiger's chasing me, it's all that kind of stuff. And most of us, me included, Most of us live in sympathetic dominance. When that happens, you've got a lot of stress. I am mindful of it. I do a lot of things to calm that down. One of the things I do is brain tap because it puts me right into a parasympathetic, state. Another thing that I do is pray and meditate, go to the beach, get out from technology, all that kind of stuff, read my Bible, pray, all those kind of things just calm the stress down. When you can calm the stress down, then your body can function the way it needs to, and you're not going to be killing off your brain cells. So I know that was a lot today. Nobody wants to have dementia. We don't want to induce it with medication, and we don't want to induce it with stress. So we're going to give you some resources in the links. Probably won't get to that till next week because today's a very, very busy day, and I don't know that I'll have time. However, I want you to have the tools that you need so that you can make the decisions that you need for your family, for your loved ones, and you can stop the dementia process if it's already started, or possibly prevent it if it hasn't. So I will talk to you soon. It is the weekend. Have a great week. Do self-care at the weekend. Relax, recover, do all the things that you need to do, and I will see you next Friday. Thank you so much.